The National Center for Healthcare Leadership named the Leadership Award in honor of Gail Warden, its founding chairman and president emeritus of Henry Ford Health System. Gail is one of the healthcare's foremost leaders and innovators in healthcare delivery, community wellness, and health policy. He also mentored and inspired to future generations of healthcare leaders throughout the U.S.
I've had the pleasure of working with Gail and experiencing his leadership directly for a great number of years. I've also been an active member of the National Center for Healthcare Leadership in numerous ways. We believe that the right evidence-based leadership produces the best quality and best collection of talent in healthcare. Gail led by example and really is the hallmark for the creation of the National Center for Healthcare Leadership, which now continues that mission. Henry Ford Health System is so honored to participate in this video tribute. The Gail L. Warden Leadership Excellence Award allows us to capture and recognize those that are now doing what Gail taught us.
I don't know a healthcare executive on the scene in our country who has earned and merits more respect than Gail. I also really admire Gail's lifelong investment in the development of leaders, especially young leaders. His commitment to helping nurture and bring along talented people who will emerge as the Gail Wardens of the future has been evident to me right from the start. Extraordinary vision and a willingness to invest in that vision.
Healthcare management profession largely was defined by Gail Warden. He knew it was a calling. He knew there were times when you had to sacrifice your institutional bottom line on behalf of the community's bottom line. And now more than ever, those are the leaders we need, and those are the leaders that we want to recognize through this award, which is a fabulous, fabulous award.
In 2005, NCHL established the Leadership Award to honor leaders from health systems, public health clinics, research and education, and national associations. The leaders honored espouse characteristics that made Gail's leadership unique and important to the field. Innovation, fostering strong leadership practices in leadership teams, mentoring and role modeling, boldly crossing organizational and professional boundaries, and being recognized and respected by local, state, and national organizations and policymakers to shape our industry and to make a difference across communities.
The award carrying Gail's name epitomizes, his values around leadership. The person that receives it, in some way embodies the values that Gail holds most dear.
In 2009, NCHL named the Leadership Award in honor of Gail as an enduring tribute in recognition of Gail's leadership legacy. Over the years, we've recognized many giants in the healthcare field as recipients of the Leadership Award.
Winning the Gail Warden Leadership Award for me was kind of the ultimate in my career because Gail was my mentor and had admired his leadership. So it really was the ultimate recognition to receive the award.
Gail's influence and impact on healthcare and communities has been profound. He has led and served on the boards of many organizations throughout his career, role modeling boundary-spanning, innovative, and inclusive leadership. Gail also demonstrated his commitment to future healthcare leaders through his sponsorship, mentorship, and as a longtime faculty member at the University of Michigan School of Public Health.
I met Gail Warden in the 1970s, and I decided that I was going to model my career after his by being a hospital administrator, but always keep my feet in academia like he did. And I thought that was something really valuable about his career. He always trained his mentees to focus on the theory as well as the practice.
I learned several things from Gail. One was get to know intimately the community that you are serving. And so if they see the leader of that organization as relatable, as someone who's out investing in the community, and someone that they can trust, then they feel more confident about coming to your organization for healthcare.
It became very clear that Gail had a major commitment to addressing health and healthcare disparities, to actually finding ways to achieve health and healthcare equity. If we have a diverse workforce and pay attention to diverse ideas and thoughts, and then we have a very inclusive environment, then that puts us on a great path
Gail was often recognized as one of the 100 most powerful people in healthcare, and he has received several of the highest honors in the field, including the American Hospital Association's Distinguished Service Award and induction into the Healthcare Hall of Fame. His leadership legacy is legendary.
Well, Gail was an individual who really embodied the values of great healthcare leadership. Gail understood that every person counts before most people in healthcare did. He understood that every person should have an opportunity to lead if they had the capability to do so. And he opened doors for all of us who had the chance to work with him and to know him.
It's hard to define Gail's legacy in any single word. If anything, it's a kind of confidence in long-term vision, the ability to really be farsighted and see that something can be built over time and space that others may think is impossible. His capacity to think broadly, I think, marks his legacy.